OT positions in surgery is one of the most basic things that you should know before you start your surgery postings. Or even if you are a second year or a third year MBBS student, this is pretty important and handy. Welcome to my channel guys, this is Joanne and I will be teaching you OT positions today. So let's begin with the images and then we will dive into the details of each of these positions. So first we have the supine position. You can see this is kind of a neutral position. This is the Trendelenburg position. The head end is raised and the foot end is lowered. Below it is the lithotomy position. Here you can see the legs are raised and there is kind of a support here. The third one is the jackknife position, and here you can see the chest of the person is compressed and there can be some issues with this which we will be seeing in a few minutes. This right here is the sitting position. So here the person's head is raised and this person is in a sitting or Fowler's position. This is a lateral or kidney position. The name is self-explanatory. This is a prone position. The person is lying on his front. And this is the reverse Trendelenburg position, which is just the reverse of the Trendelenburg position. So here the foot end is raised and the head end is lowered. Got an overview on the images, and now I'm going to explain to you how these actually work, right? So in the supine position, you can easily visualize the abdomen, the breast, and so it is most common position for abdominal and breast surgeries. It is a neutral position. The head end and the foot end are at the same level. Then we have the prone position. So supine, prone, I want you to remember it together. So prone means like on the front, you lie on the front, and so what can you see? The spine, so you use it for spinal surgery and pilonidal sinus surgery. Next we have the Trendelenburg position. So in the Trendelenburg position, I told you the foot end is raised and the head end is lowered, so it is used in pelvic surgeries. Why? You can just imagine, right? Because of gravity, the bubble and all will be pushed down. Yes, and so you can easily access the pelvis. So that is the Trendelenburg position. Reverse of it is the reverse Trendelenburg position. Pretty self-explanatory. That is, the foot end is now lowered and the head end is raised. So what happens? The bubble will come down again because of gravity, and you have the liver and the gallbladder. You can do laparoscopic cholecystectomy. The next one is lithotomy position. So both the legs are raised and separated with a gap and they are held by stirrups. Why do we give that support? Because otherwise there can be peroneal nerve injury and you don't want that. So, and this is done in obstetric, gynecological and urological procedures. I think you would have observed this in your postings when you go for OBG postings. Next position is the jackknife position. I told you earlier that the chest is compressed and this position can cause positional asphyxia. It was used earlier for hemorrhoids and fissure surgeries. Now we do not use it anymore because of this complication. Next is the sitting position or the Fowler's position. So the Fowler's position I showed you in the picture earlier. This position, the person is just sitting like that and then the head is raised, so there is a risk of air embolism, and for that you have to ligate the veins beforehand so that the veins do not get nicked and there is no air embolism. So if the vein is like this, we ligate the vein like this and then cut it so that there is no chance of air embolism. So the advantage of this position is the relatively bloodless field and there is good exposure. And the disadvantage, I explained it. This is used for posterior cranial fossa surgeries, but this risk is inherent. Alright, next is the lateral or kidney position. So the person is made to lie on the lateral side and then we can use it to access the kidneys, because you know the position of the kidneys. Yes, that's correct. Or you can use it to create a flap in the latissimus dorsi, so that you can use it for thoracotomy, pylolithotomy, nephrolithotomy and nephrectomy. And that is all about the OT positions in surgery. Do like, share, subscribe and comment if you like this video. Click the bell icon so that you get notifications and do not miss a video. Until next time, bye bye.